Thank you so much for joining this week's Internet Address. I'd like to take just an opportunity to update you on the latest developments in this ongoing important healthcare debate. I recently had the opportunity to meet with Senate Majority Leader Reid and to share my ideas and concerns about the legislation being shaped in the Senate to improve our nation's healthcare system. I'm encouraged by what Senator Reid said. He's reached out to all members of our party, moderates particularly, as well as Republicans when possible. During our meeting, I shared with him many of the concerns that Louisianians have raised to me, including the prospects of increased taxes, the threat of a government plan that could get out of hand and expose the government to more expense. So I remain somewhat skeptical of a government-run, government-supported public option, but I am more than ever committed to finding a way forward to provide affordable health insurance for low-income, middle-income, and even wealthy individuals, some business owners having themselves a very difficult time providing health insurance. So I understand the threat of rising health care costs, those threats to our families, to our government, and our business, and I am determined to find a better way forward. These costs could potentially bankrupt Medicare, as you know, put tremendous financial strains on our nation. So during this debate, we've spent too much of our time, in my view, arguing over the issues that are of secondary importance. We need to focus on fixing a broken healthcare system, reforming the private market, and redirecting our goals, our focus to two particular goals: increasing competition and reining in costs to the government, to businesses, and to individual families. Without cost containment and marketplace competition, and I would add reform of the private insurance market, we will never be able to succeed. As I've mentioned before, in 7 years, the federal government will have a severe bill to pay for Medicare if we don't make some changes, and we must provide options for middle-class families and lower-income families served by Medicaid. So some of the statistics, as I've reminded all of us in past addresses, that if we don't get these costs in line, many families are projected by the year 2016 to be spending upwards of 60% of their household income on health insurance. Now that's for average families where their income is $30,000 or $40,000. 60% is what it would cost to provide status quo health insurance. That is simply unacceptable. So I'm working hard to find a principled compromise, one that Democrats can be very, very proud of, one that achieves our goals and President Obama's goals, which is affordable choices for all Americans, expanding coverage, but in a way that drives costs down. And in my view, it is possible. So I thank you for joining us today on this internet conversation. Please continue to let us know how you feel, what you think. This debate is ever-changing every day. It is really, I think, been very obviously engaging to so many, and I'm happy to be able to give you an update this week. Thank you so much.